Okay, as part of M.E Awareness Week, I'm really happy to be talking to Rachel Makepeace today from the M.E Group Australia. Hello, Rachel.
Hello.
Hello. This is actually the second time we've done this video. We had a little bit of a technical glitch with the last one. We are both more exhausted than we were in take one. So fingers crossed that this goes okay. Anyone that doesn't know anything about ME, we've both got ME. I'm at the milder end of the spectrum. Rachel is at the severe end. Rachel is doing this interview from bed. I'm able to sit upright in my office, but as you can tell from my voice, I am not great today. So been looking forward to doing this interview. So I've given Rachel 4 questions to ponder before we spoke online, just so that Rachel can get some thoughts in a row, because cognitive impairment is an aspect of ME that all of us suffer from. So
Yes.
the first question that I asked you to think about, Rachel, was in 2024, what does your organisation consider to be the top 2 priorities in terms of your work and advocacy?
Okay. So, first of all, I like to say the big purpose of vision is to create the specialty ME clinic. That's the massive goal. But in order to do that, we have to work small step at a time. So the first key point in 2024 is capacity and credibility building. Because I'm a health consumer without any, I'm not doctor or clinician. So gaining the trust from the healthcare community takes hard
And
work.
how are you doing that? How are you building that credibility and trust?
Okay, so we are going to do webinar events for M.E Awareness Day, and we're going to share our knowledge and then live the experience there, so that it's an evidence-based knowledge and then valuable lived experience, so that we're going to show that we mean what we mean, and we have a knowledge. And then also we have a discussion around podcast and CPD content. I don't know how it goes, but it's an important credibility capacity building space. So we'll work on that even just for the strategy. And the other important thing is community building, because basically I'm severe ME means I cannot go out into the community, so nobody sees me, and people like me don't have the community to go to. So community is online based, so that people like me can have a safe space to talk about anything, and also educate each other about this condition, disease, or disability, so that we support each other. And then when I say community, it's not only patients. We also need to have a different community for clinicians and doctors, so that they can also create a safe community within their capacity and achievements, and then share their experience and knowledge among them.
Okay,
Yes.
no, that all sounds fab. It's that's partly why I'm interviewing you today, because I like to support the smaller or newer organisations that some in the community may not know exist. So I'm very happy to speak to you today, because I've been chatting to you for a while, but that doesn't necessarily mean that people that have been recently diagnosed with ME, possibly they're still under the umbrella of long COVID, but meet our criteria. And we know that there are many of those. So alongside this video, I will put a link to your website so that people can get in touch with you and learn more about your organization. I
Yeah,
think
it is.
small steps, because you are building the credibility, is actually one of the biggest tasks. I mean, people knew me as an ME advocate for about 6 years before I launched Stripey Light Bulb, and I still faced distrust, What's she doing that for? You know, is this a money-making thing? People shouldn't be making money
Yeah,
off ME. I have to tell people, no, we're a not-for-profit. 50% of any money we do make, which we haven't in 5 years yet, but any money we do make, 50% goes to research. Everything I do is for the ME community. And
yes,
it's very slow and steady building trust.
yeah.
So I do think you've got your priorities in the right order.
Yes, trust takes time because this is a community of traumatized by the very healthcare that we're supposed to receive care and help. So that it's breach of trust is serious and severe. So that even we try to share the knowledge that truly understanding our lived experience and situations, including all the inequity, but people still doubt about our intention, which is understandable.
Yeah,
And
there's been an awful lot of bad faith actors over
yeah, but
decades.
we have to show it by action. This is nothing that just talking can resolve it. We have to show it by action, so that takes time too. So
Yeah, completely
yeah.
agree. What is your organization currently working on?
Okay, so the currently working is the credibility capacity building, and then at the board level, we are refining our strategy. So the at the recent board meeting, we are focusing on, we have a vision of ecosystem attached to our dream of specialty clinic, but in order to do so, we really need everyone to understand our vision. So the ecosystem that's going around the ME Group Australia's clinic that involves research organizations, university educations, and then doctors, clinicians, who understand support patients, and also the patient health consumer community, and also healthcare advocacy. So we don't recognize ourselves as advocate, but without healthcare advocacy or health consumer advocacy, we cannot achieve our goal. So it's all intertwined to each other and then create an ecosystem that is actually happening in the specialty, medical specialty that's already official, and then happening in healthcare system like cardiology, neurology, things like that. We don't have anything like that. So with the clinic and ecosystem, we're hoping to create the same system, ongoing education, capacity building, and knowledge translation kind of thing happening.
Okay, I've got a note here that says ME Awareness Day webinar event. Do you want to tell everybody about that?
Yes. So this is our very first event. I'm fortunate to have committed and passionate volunteers helping us in this space. So it will be 3 parts. So the first part is about understanding ME. So we go into clearly, demonstrate how to make accurate diagnosis of ME using ME ICP. And that's the start, because that's the question we receive a lot from GPs and clinicians, and the researchers also add the knowledge happening around that. So that's the part one. And part two is about caring for people with ME and then also long COVID that meets the criteria of ME ICP. And then from there, what can the clinicians and doctors do for the people who come to their door for help, seek support? So that's about treatments, and then it's multidisciplinary team, so that what they can do, specialist, occupational therapist, psychologist who's not into CBT. She's more like coping, grieving, and so that real help that we need. And then exercise physiologist. She's also not into grading.
Yeah, you have to put that caveat. No, she doesn't.
Yeah, so, I know. So because exercise in her professional name, and then so we need to debunk the myth that these allied health practitioners are not out there to harm us. They are actually willing to help us, but we need to understand what they actually do in the healthcare system. So because of the trauma we experienced by the healthcare system, we tend to be really defensive. Just hear the name exercise and psychologist. So we hoping to debunk the myth and open up for the courage for patients to reach out to these, the help if they can, kind of thing. So it's very basic, and occupational therapy has lots of ideas. It's such a versatile clinical area. So, and then part 3 is about lived experience, so that we have a panel of patients, and then we're going to ask set questions and to understand lived experience, and then how M.E or concept or of the M.E affecting them in everyday life. So then a little bit of Q&A.
Okay, and how do people sign up for that? I'm assuming it's online. Is it for people outside of Australia or only people in Australia? Because I'm sure people will ask me, so it'd be good to know.
Yes, yeah, event will be in Australia, and it will be recorded and then shared afterwards. So currently there is the event. Sorry, my brain's dying.
That's all right. Event link, like event link.
Yeah,
like Eventbrite in Australia.
Yes, and then it's in blog post we recently posted, and the actual event link will be shared as soon as it's available. And I will try to make events on Facebook and LinkedIn, but you still need to use that link to the event site. So
okay,
yeah,
that sounds really good though. Sounds really a lot of
thank
work.
you.
Really good. Yeah. Okay, last question. Is there an increased prevalence within the Aboriginal and Torres Strait Islander peoples, as with other non-white populations around the world? Is research available, or is this another neglected research area?
Okay, so I would say in one word that it's a neglected area, because people, First Nations people, are not really included in research happening around here. And then in Australia is embracing consumer-involved research or consumer-involved clinical care model, so that we really need to reach out to them. And as you can see, I'm not a First Nation. And then
I should explain. I know I did a bit of background research and saw on your website that this group is specifically mentioned. That's why I was interested.
Yeah, that's Australia's attempt for reconciliation with traumatized First Nations people, and we always need to conscious about the harm done to them, and we need to always acknowledge, their past, present, and then the future, and in the future we definitely have to involve them effectively. That means they must be part of the research and then clinical care model and everything. So we are very behind on this area.
Thank you very much for talking to me today, Rachel. And I hope
Thank
you
you
have
so
an
much.
absolutely awesome M.E Awareness week and day.
You too. You too. And
Uh,
thank you so much for asking me for this interview. It's really fun, actually.
It's my pleasure, Rachel. Well, you take care and I'll catch you again soon.